there are growing concerns from some care providers across Oregon that adding more rules now will make it more difficult for them and make it more difficult to recruit new child care providers. How do you deal with their concerns? How do you address them? And have these concerns been heard in putting the rules together?
Child care providers are an essential asset in our state, and we know that child care is a critical support for families, and particularly in the first 5 years of a child's life is absolutely essential to support their development and their learning and their readiness for kindergarten. And so it's just it's really important that we have child care rules and regulations that work for families, that work for children, and that work for providers. We're engaging in a process as we think about all of our rule changes where we stay in contact and we hear from providers. We take the input that they give us very seriously and want to continue to do even more to stay in regular contact and communication with them about what are the rules that are confusing for them, or rules that we should be better informed by their experience in delivering care every day. I think as long as we continue to do that, we're going to really be in a space where we have smart regulation. I believe and know that child care providers and families and my colleagues here at the division, and myself included, we all want the same thing. We want to ensure that we have the best environments for children in our state when they're outside of the care of their parents. And so we are very much committed to working through our processes to consider these rules and get the input of families and get the input of providers. So we have really smart regulations and we can implement those regulations and support providers in being successful in meeting those regulations. So when we think about how we have new regulations and they're really aligned to what are the best practices for keeping children healthy and safe in care. We need to first get their input into the right regulations, and then we need to stay in ongoing communication with them about what is difficult about this and what supports do they need. We have other investments and resources at the state to where that we can utilize, right, to really understand where are those barriers, right? Where are they needing more support in order to feel successful? Because at the end of the day, we all want the same thing. We want children, providers, families, and the early learning division all want the same thing in terms of experiences. Positive experiences for children and families in care. So we can start to utilize some of those resources in ways that are more directly aligned to where child care providers are telling us they need more support. So I think that that's one strategy that we'll continue to look at. We know that the resources that we have right now to really be able to give providers technical assistance, to help them feel successful and not challenged by meeting best practices around the health and safety of care are not where they need to be. We don't, at the same time, while we can be very smart with the resources that we do have, and we need to do that, and get input from providers on how we utilize the resources we have. It's not enough. I mean, most providers have very limited technical assistance, professional learning experiences. Many of them, particularly our home-based providers, are isolated, right? Who with very limited opportunities beyond, a minimum level of required training to really engage with other providers or other specialists in early childhood education, really to feel that they get the support that they need. And so that's really important, and that's something that we're working on where with Governor Brown and with the Early Learning Council, with other stakeholders and business leaders to say what are what more can we do really to increase the supports that are available to providers to implement best practices? So those are some of the immediate things that come to mind. We also need to understand that the challenges with supply in the state of Oregon are really complex, and there are a lot of factors that go into that, and regulation is just one part of what affects supply in the state of Oregon, the child care supply and the affordability and accessibility of quality, affordable child care for families. And so, again, this is another area where the Early Learning Council, chaired, by Sue Miller, key leaders in the legislature, and the governor and other stakeholders are really working on a much more comprehensive approach where we can tackle many more of those really systemic issues, and really look at what are the ways in which we can bring some stability to the supply that we have in our state, build supply, help more families afford quality child care, help providers really get the kinds of reimbursements for providing care that are more aligned to what the true cost is to provide quality care. So those are more of the comprehensive strategies that we need to really look at ensuring that we have a supply of quality care in Oregon.
Speaking of supply, it's a concern in Central Oregon. Is that similar to concerns elsewhere? Or do you know whether Central Oregon is any different than other places in the state?
I've really had the opportunity in my first year in this job to visit many communities across the state, Central Oregon, Southern Oregon, coast communities, Eastern Oregon, and I'm hearing really consistent themes and concerns about the supply of affordable quality child care, particularly for infants and toddlers. The Early Learning Council has been engaged in a 10-month strategic planning process where we've been hearing from communities, from families, from child care providers, from other providers working in early childhood education about important priorities, and the lack of supply, particularly for infants and toddlers, has come up again and again. And so we know that really comprehensive solutions are needed, and very focused, intentional strategies that really build supply is something that we need to focus on. And that's really the work that the governor has been leading with her children's cabinet, and that the Early Learning Council has been undertaking, is sort of what are those strategies. We also, I should mention, with the support of one of our Early Learning Council members, Dr. Bobby Weber, conducted some analysis to look at, after hearing this repeatedly through the strategic planning process, to look at some data to say, what are the communities that we should be really focused on and targeted in where there is a lack of supply, particularly for infants and toddlers. And we learned just through that, just very preliminary initial look at data on supply and estimates of demand for care for infants and toddlers, that the entire state of Oregon, except one county, has an inadequate supply of infant and toddler care.